COVID-19 in the country. Earlier, we spoke to Dr. Sabin Nsanzimana, the Director General of the Rwanda Biomedical Centre, about the status of the pandemic in the country. Dr. Sabin, slightly more than 4 months ago, when the first corona patient was identified here in Rwanda, so far 1,700 people, more than 1,700 people have been infected, with more than 900 who have recovered, and more than 800 active cases, which shows that the recoveries are many, but the number of active cases is also still pretty high. Could you paint for us a picture of COVID-19 infections in Rwanda and what it means?
Thank you very much. I think we're seeing that every day there are new infections of COVID-19. And it means that the virus is still around, and people should really take precautions and prevention measures as required until we get a vaccine or a curative treatment, which is not really very soon. I mean, we see the trend, we see the evolution. People are moving around, and the virus is moving with people. So the key message here is that everyone should take responsibility to make sure it doesn't become like a bridge to where the virus comes from and passes to another person who may not even be symptomatic. And things become worse when someone who is vulnerable, has maybe other conditions, get complications and may even die. So we are still with the virus. We don't see COVID disappearing any soon, and what we have to do is to make sure we prevent the spread in our communities, in our offices, where we live, where we work, and it's everyone's responsibility. And it's important to protect the community where we live. COVID is still around. We see cases every day. There's some regions that are affected than the others, but I believe that we can prevent it.
About the recent development of the results from the trials involving 3 different coronavirus vaccines that were released, that all showed positive results with evidence that the vaccines could produce immune responses that would protect people against the infection. What does this mean for the fight against the pandemic here in Rwanda and globally?
Thank you. I think for any pandemic or any disease, the best tool to prevent or to end it is to have a vaccine or a treatment that can cure that disease. So in terms of COVID-19, this virus called SARS-CoV-2 has been quite a challenge, but also remarkable advances in the scientific development. When you see how this vaccine development process is moving. It's on one way, it's a good news that on the side of the science, there are things happening. But again, it doesn't mean that we're going to have this vaccine tomorrow. We will probably need to wait some more months, probably mid next year, to have a vaccine available. And availability and accessibility are quite different when it comes to this pandemic, because everyone in the world really wants to have this vaccine. And the production capacity will not satisfy all the needs. So we have good news. Some solutions coming on the way. But again, accessibility will need really to think on how, as a country, we position ourselves to access it, but also to be part of this development. And we already started. So the message is, what can we do to prevent the spread of this virus until we access this vaccine?
Absolutely. What's the current status of the COVID-19 testing in the country?
So testing is always the heart of any response in terms of pandemics and epidemics outbreaks. So you always have the lab capacity that provides the result in a quick turnaround time. So we've been working on decentralizing the diagnostic capacities from national reference laboratory into provinces. So far, all provinces have the capacity to test for COVID-19, except the northern province, which hopefully in the next couple of weeks will also be able to test. So if each province is equipped with diagnostics, and hopefully next we're also getting new technologies for testing, antigen tests probably coming soon. We will be able to do more tests. Currently, we are doing 4,000 a day, and we aim to attain 10,000. But we continue to expand. You never have maximum tests. You always wish to do as much as possible. So this is how you know where's the virus and how you can prevent the spread.
Absolutely. Many thanks indeed, and we appreciate your time, Dr. Sabin Nsanzimana.
Thank you very much.